The Regional Health Officer of Region 6 gave an update on the developments in the region's health sector in this Jalissa Hines report.
We would have had in the region 2 sites that does VIA in the region, which is Keldon and New Amsterdam. And you know VIA is an early screening for cervical cancer. Of those 2 sites, we would have added a 3rd site last week, which is Fort Morant Health Center. And we know that, and I said this earlier, whatever we do is to ensure it's equally distributed across the equitable and equal. In addition to that site last week, we now have Guyana, so that gives us 4 sites across the region.
That was Dr. Vishali Sharma, Regional Health Officer Region 6, updating the public on the developments in the health sector in the region at the opening of the Women's Wellness Clinic last Tuesday. Further, on the efforts to make VIA tests available to all female residents, Dr. Sharma said,
So January would have been cervical health month, and we would have done outreaches across the region as well. And we would have done 6 in total, including Baracara, Brothers, Oriala. In these areas, we would have managed to get at least 20 persons per site. And we're extremely happy. Specifically, the response in the area of 64 Health Center was extremely good. The rest of the communities, we have work to do. For example, Maiduguri, we would have only had 5 persons. So obviously we need to go there and do a lot more sensitization.
She then revealed these details.
Brothers being a dental site and now 64. So definitely based on how the response is, how the public is accessing, we will be spreading out these services across the region. And one of the things is that if you notice, even the diagnostic services is distributed across the region. Like for example, because of how we would have been improving our diagnostic capacity, we now have Thursday, thanks to the government of Guyana, thanks to the investment and the work being done by the government of Guyana, now we can safely say that we're in the process of taking ultrasound services to the community of Maiduguri for the very first time.
Regular outreaches have been executed in a number of areas in the region.
It's now definitely more regular. We regularize our outreaches. For example, the first week in every month, first Monday is Baracara, and yesterday, after a very long time, we would have taken dental, and the response was tremendous. We would have had 31 persons who accessed just the dental services, with over 100 persons actually accessing the services. And for example, that's Baracara, we do that once. Oriala, because we already have a team and we have a doctor there, we'll be going once every 6 weeks. So each outreach we go, we try to take an additional service to the community rather than just the routine medical services.
Additionally, regarding outreaches, Dr. Sharma added,
Mara, we go every Wednesday. We go to that community every Wednesday. We have also started new outreaches. Fort Ordonance, for example, in one of the communities, because of this, it's developing, and it is becoming a very big scheme. So we would have added medical outreach there as well monthly. So in that way, we can be able to say that for the year we would have done all of this, and we would have captured most of our people needing healthcare.
In conclusion, this is what she had to say to persons who access public health services in Region 6.
Definitely, the system is not perfect, and we will have complaints and we will have issues, and once there are those existing at these facilities, is that let they engage the management of that said facility, or even myself, and we'll definitely be able to assist. To make you a lot more comfortable, and of course to continue accessing the public health sector.
Reporting for Channel 8 News, I am Jalissa Hines.